There. Hi everyone, welcome again on this sunny day, at least in the Niagara region. So let's get started as we have lots of content today. So today is part 3, goal setting, like Allison said. And as you know, or if you're joining for the first time, I'm a master's level, I have my Master's of Education in Curriculum. I'm a board certified behavior analyst, and I'm also a speech and language pathologist. And I've got training in different areas, and I have a few conflicts of interest to declare. One, I'm a salaried employee of Autism Ontario. Second, I am a clinical advisor for Lingo, which is a software app for communication. And I'm on the advisory committee of the Association for Science in Autism Treatment. Also would like to make a brief statement about language. Language is important to everyone, and autism means something different to everyone. So medical professionals, researchers, and providers may use one term, and individuals or their family may use a different term. The different terms you'll hear me use throughout the presentation are identity first, so saying autistic person, and person first, saying a individual with autism. And so I'll use both those terms interchangeably to be respectful of all attendees and stakeholders. And of course, you have your right to choose the label that you would like to use. So briefly, the agenda for today is a brief review of parts 1 and 2. And what we'll do next time, if you join, is probably not do much review because it doesn't leave us a lot of time for content. And you can access those presentations offline. We're going to look at getting your answers from your assessment, helping to choose that AAC system, and then how do you determine your goals? So what goals do you choose? How do you choose them? What are the prerequisite skills? What about vocabulary selection? And I know that has come up a lot in the past. And then some challenges you may encounter when you're working with your child or the individual that you're providing services to, about working with people who have varying opinions to yourself. What does the research say? Where are those points that you just be aware of where there's some challenges to providing services or looking at AAC for your child? So again, briefly, who would benefit from AAC? So we know that approximately 25 to 50% of individuals with autism remain minimally verbal, meaning they're not really functionally able to use speech throughout their lives. So that functionality of speech, so can they say words that are intelligible? Can they string words together? Are the words they use accurate for communication? And what we know so far is still that up to 50% don't have that ability. And so the research does say for augmentative and alternative communication, which is AAC, that it really isn't about the iPad or an SGD, which is a speech generating device, but really it comes down to 3 things: that it's the hardware you pick, or no hardware if you're looking at sign language or picture exchange. And if you have hardware, it's the software you pick. So which app are you using? Because they're all very different, and some have research evidence and some do not. But really it's training, and the critical component of introducing an AAC system and teaching communication and language to your child is the training. So what is the training like? Do you have support? Do you know how to go to the next step? Do you know what to teach? And that all 3 of those things really have to come together in order to get the best outcomes. And there's not a lot of manuals to help you. Picture exchange communication system is the only manualized intervention, meaning it has step-by-step for you to follow that has been proven. Nothing else is manualized. So it really comes down to how much training do you have and support. So we're going to, again, keep going through what we covered last time. So that assessment for AAC, and we talked about looking at different areas. And there is a checklist in the resource section and a scale to assist you in making decisions about goal development. So let's quickly look at those 12 skill areas that you should be getting some information on. And you should have at least assessed a little bit before deciding on the type of AAC system and goals. that are required for teaching. So the first one is sensory impact. So the individual's response to touch, sound, and visual information. Joint attention, which is that sustained attention to objects or activities and sharing that with somebody else. So joint attention means that you join in attending to something that you're both looking at. And that's a prerequisite skill for language and communication. Social interaction, so initiation and social approach skills. Those early communication skills, so pre-verbal skills such as pointing, using gestures, leading, being near something that they're interested in or want to talk about. And those early communication skills are critical. And then reinforcers and motivation. So those words for the items and activities that that is important to the autistic individual. So what are those things that motivate them to want to communicate? Number 6 is the acquisition rate for new learning. So what we're talking about there is, do they easily learn new things that you're teaching them or showing them, or does it take a lot of repetition and a lot of time? There are individuals that we call kind of one trial learners, where you show them something once and they've got it, and so you're going to be moving quickly. And there's other individuals where it can take months, sometimes years, for them to actually learn a new skill, and that takes a lot of teaching and patience. So that will give you an idea too about which system might be better for the individual. Comprehension. Comprehension means understanding language or receptive language. Are they able to understand a word that you're using or a phrase? Can they follow instructions that are out of context? So meaning, if you're sitting at the kitchen table and you say, go get your shoes, but they're expecting to eat, could they follow that instruction? So do they understand each of those words and what they mean? Imitation skills are critical. So imitation skills are those things that help you learn, help all of us learn. It's how we learn social skills. We imitate other people. So fine motor skills are critical for sign language, for picture exchange, for pointing on a device. Gross motor skills is important for, again, all of those 3 types of systems. And then imitating through observational learning. If they watch you do something, can they do that same thing? And a lot of speech pathologists, we will talk about aided language modeling. So if you have a device to show them what you're doing, and that is only really showing in the research, only really helpful if the individual has really well-developed imitation skills. Otherwise, you're not going to be able to benefit from that. Visual discrimination skills, understanding pictures with meaning. So a picture of a round circle, do they understand that that can mean a ball, any ball? So it doesn't have to be that exact color of ball, and things like that. And that's different from perhaps a picture of a donut, which has a completely different meaning. So do they have those abilities to discriminate those pictures? Communication functions. Speech pathologists call them communication functions. Behavior analysts have a different meaning for the word function. So sometimes there's some challenges with terminology, but it really means how do they use language and communication for different purposes. So requesting things, or in ABA it's called demanding. So commenting on things that they see, or tacting it's called. Those greetings, so saying hello or goodbye, or sharing information, answering questions. Those are all, different types of communication functions. The other thing that you should be assessing is speech sound development. So does your child or the autistic individual you're working with have any kind of vocal ability? Do they have a variety of speech sounds? Do they use them constantly, or do you hear them infrequently? Are they able to have word approximation? So it kind of sounds like a word. Sometimes you understand it, or the family may understand it, but other people don't. They're not as intelligible to other individuals. Or do they have some really well-developed, really intelligible words? And you want to have an assessment of that, because the research has shown that for individuals with autism, some of those kind of wives' tales of earlier, or the training that speech pathologists had earlier saying AAC will not hinder speech, AAC will help speech develop. We covered in part 1 and 2 that that actually hasn't been proven with individuals with autism. So we have now seen in some research studies that include individuals with autism and AAC that it may limit the amount of speech and vocalizations that they produce after the AAC has been introduced. Or it may actually not help them develop spoken language, and you're going to have to program for that separately. So you want to have a good comprehensive assessment of their speech to make sure that you're maintaining speech, and or that you're seeing that, okay, speech isn't developing, any vocal ability isn't developing. We're going to have to actually work on that separately. And then the last thing to really understand more, about the child or the individual is, are they communicating with their peers around the same level? Mental level system that will allow them to communicate with their peers, so that you can start to have that social interaction and that wider communication. So all of those things we want to look at as part of your assessment, and we touched on that last time. The other thing that we touched on was this assessment for AAC. So what are those steps? If you're looking at kind of gold standard in assessment, then you're going to be looking at a number of steps. And we touched on them last time about determining their different levels of ability in language, learning, motor, which we just went through. You want to observe the child in a lot of different settings. You want to involve a wider team. So they may be completely different at school or daycare or at a relative's house. And so you want to really get that information from different people. If you have a speech pathologist, occupational therapist, behavior analyst, get some information from them. And then a dynamic assessment is something that professionals do typically, but parents can do it. And it means trying things out. So does your child learn better if you use some more pictures? Are they better if you use some gesture prompts or physical prompts, and then you can fade them? So how best do they learn? Because when you're teaching, you want to have an idea about that. After you get all that information, you're going to do this feature matching, which means you're going to take all of that assessment information. You're going to look at all of the different AAC systems that are out there, and make a decision about which one seems to match the individual best, because that's really what we're trying to do. Meet them where they are. Doesn't mean that that will be their system forever. You can change later on. Remember, I've said before, don't get married to the technology. Don't fall in love with it. Don't base your decisions on it, because technology now is changing more than every 6 months. So we're in a really rapid state of technology change. So it's really not about that. It's about what skills do they need and what do you want them to do with communication. And then really it's best we recommend to trial a couple systems, because that individual also has the right to have a preference. And so sometimes a parent or a professional will recommend something, but the individual actually shows us through their behavior and their accuracy and competency that they prefer something else. And so it's best if we have that kind of choice making involved. And so we talked about this already, that I've gone through this, sorry, without going through my slides, but you also want to take into account the family's values and wishes. So sometimes there's not a good agreement from professionals and parents and educators about which thing would be best. And we really have to have some really open discussions about that. What best match as possible. You want to consider cultural values. You want to consider what's happening in that home. You want to consider the stressors already placed on parents, and need to be realistic. And it's hard sometimes, I think parents may feel sort of less important, or that they have to agree with the professional. And really what I say to parents is you have to be honest. There's no use saying that you're going to agree to something or go along with something if you know it's not going to work, because then you're wasting time that you could have actually gone through with a system that would work for you. So there's really your wishes and what we see from that individual are part of the equation. So a professional's job is to tell you about what the research says, what skills that individual has, and then take into account the clinician's expertise, but your wishes as well. And then there's lots of other considerations, financial considerations, materials that you may need, and then consider if you have additional support or not. So do you have a team that can help you with this, or is it just you? And where can you reach out when you need some help? So those are some of the things that we touched on last time. And I wonder if there are any specific questions. Remember, if you haven't been here, and watch those because I go through it much slower. But if you have any specific questions, then what we can do is look at that right now. So I see there's one about who's qualified to make decisions about assessments of AAC and its implementation. That depends. That depends on the provider or the clinician's training. So some speech pathologists will have the ability or competency and expertise to make those decisions. Some behavior analysts have that training. Some educators have that training, and there are AAC specialists as well. And so again, it really depends. You have to ask those questions of the people that you're working with. What's your education in this? What's your experience in this? How many individuals have you worked with AAC? So it really does depend. And someone asked about last week, and I'll talk a bit more about it in the session, about core language and autism. And so we will be talking about that. So I will keep going. So now we're going to look at choosing appropriate goals. And what I've done from those assessment steps we just reviewed, I developed this kind of worksheet for you. I developed this chart to help you decide how to make decisions about goals. And so you can see that in that first column, there's those different assessment buckets that we talked about. And then there's a scale across the top from 1 to 5 that does your child never show those skills, or all the way to they always show those skills. And so what would be helpful is as you go through your assessment, and again, assessment can be informal, can be observation of you watching your child or watching the student you're working with. You then, I would suggest that you check off. So for excuse me, do they never show that? Rarely, sometimes, often, or always, and put a check mark in which box is the one that fits. And if that check mark is in the number 1 box, number 2, or number 3, then put a check mark all the way in that last column that says a required goal. So that's implementation. So again, you're going to go through and you're going to finish both pages. There's 2 pages to this, and it's in your resources, and you're going to rate all of those different skills. So you'll see on this second page that you're rating their learning, their understanding, your imitation skills, your vocal ability, and all that. So you've got all of those ratings now. And so in those ratings, you're going to have a number of them that are now in that required goal. So that required area. And now this is where it comes to determining, what do I do with this information? So once this goal checklist is complete and you have your list of possible goals, then the following steps are going to help you make those decisions about which goals are best to start with. So teaching some of these skills before introducing an AAC system will assist the individual in learning the communication system easier in the end and with less frustration. But sometimes some of these goals may be part of implementation. For example, in the picture exchange communication system or in sign language, some of the goals that you may have shown are weaknesses for your child are embedded into those programs. So this is where sometimes it's really good to get someone who knows the programs and can say, oh yeah, that goal is in the program. So in picture exchange everything in it, step-by-step teaching, with the exception of being able to grab a picture and hand it to someone. And even then you can use physical prompting to help. You can, hand over hand help them to grab a picture and exchange it to somebody else and then fade that back. But things like attending to the pictures, scanning the pictures, making sure that the picture they're picking matches the thing that they are intending it to match. Social approach, going to somebody, waiting, not playing with the pictures. All of those things are built into picture exchange. So those wouldn't, you could just start and they will systematically be taught. However, in things that are electronic, like the iPads and the tablets and those speech generating devices, those things would fall under number 1 on this goal selection form, saying you require gross and fine motor skills in order to access that tablet and the apps. You would have to know the individual's motivation and reinforces in order to figure out the vocabulary we're going to choose. The individual, another goal that really is important with any of these systems often is delayed access, which means they have to be able to tolerate waiting. So quickly in picture exchange, if they hand something over, you can give it within milliseconds, and that's how you're taught. With a device, built in, unfortunately, to the apps is often a delay or lag in the speech or the sound. So they have to press a button, then it speaks. And it really depends on which app you're using as to, what that delay looks or sounds like. And so that may be difficult for the individual as well. It may also be difficult if there's challenging behavior in that they like to press buttons. And so then you're not really sure, which one do they want? And so then they may get frustrated that they're not getting something quick enough. So that delayed access is an important goal to work on sometimes before. And then visual discrimination skills. So do those pictures have meaning? That is an important goal for speech generating devices. It's hard to teach on a device. I prefer to actually take it in a lesson separate from a device, make sure they have it there, then bring back the device and run through practice. But you don't want to, it's hard to block them. You don't want to take the device away if that's going to be their communication system. And so it's trying to figure out now, how do we best using these other materials and tools that are in our environment. The other area that I promised I would talk about more is that vocabulary selection. So really we're talking about vocabulary. So what are we teaching? What are the words that we're going to start with? And it's critical, also controversial right now as a topic. And so what I wanted to do is have a bit more of a conversation today about that vocabulary. There are more recent articles that have examined the most effective and appropriate vocabulary to begin AAC, or even spoken language for teaching. And there are 2 main things I want you to consider. 1, teach the words that matter the most to the individual. So things that are going to motivate them, things that are reinforcing, things that are going to replace problem behavior. Most of the time, they are called fringe words, not core words. They are fringe words. They are nouns, they are things, and these fringe words are universal to all beginning communicators. So it's not just individuals with autism, not individuals with special needs, not individuals with developmental delays. Fringe words are used by all individuals beginning to communicate. So these are the common words of beginning communicators, and they are nouns, person, places, or things. If someone is insisting that you use core words, then what it may be showing you is that they haven't kept up with the most recent literature in the field. So you really want to make sure that the words you pick are going to benefit your child the most, that you're going to have lots of opportunity during the day to practice those, that those are the words that are going to be at the fore of their mind, and so it gives you lots of opportunities to practice. It's going to get them what they want initially. It doesn't mean that this is where you're going to stay. We have to teach a robust language. We have to teach all the meanings of all the words. But to start, just like typical toddlers, and if you're learning a second language, you want to start with those words that get you what you need. So all the latest articles say, for individuals that are beginning communicators, use those fringe words, those topics and words that are important to them. The other thing to consider is teaching vocabulary to replace challenging behavior. And I've talked about that a bit. So that's sometimes referred to as functional communication training, or FCT in the behavior world. And what you want to do is replace ineffective behavior with language, which will be more appropriate and effective for the learner. The other area that I just want to face on is that there's been some new controversy surrounding the type of learning style. And remember that learning styles for everyone has been disproven. So if someone says, I'm a visual learner, I'm an auditory learner, I'm a kinesthetic learner, multisensory, that has all been debunked within the last couple of years. We all can learn by different means. We may have a preference, but you don't have a learning style. And that it holds true with individuals with developmental disabilities. So there's this new thing called GLP, or Gestalt Language Processor, which is a type of learning style that's now being used to describe autistic individuals. That is, they use echolalia, or chunks of language or words or phrases, as communication. A word of caution about jumping on this bandwagon: it's not new. It was first talked about over 40 years ago, and sometimes that's where some of us who've been around a long time have history, and so we were around. I was practicing when it first came out, and it's unproven. It was an unproven theory by the linguist Ann Peters and taken up by speech pathologist Dr. Barry Present, whom I know, and they theorized that echolalia had some communication function, which I totally agree with. It can have some communication function. However, there is absolutely no empirical research or literature to support GLP or any peer-reviewed evidence that this is true for autistic individuals as a communication or learning style. There's no definition of GLP. That is, someone hasn't said, oh, this makes someone a Gestalt learning processor and these things don't. We can't measure it if we can't define it. And there's this 6 stages that GLP individuals go through that Dr. Marge Blanc talks about in her book. Again, anecdotal, based on her clinical experience, but there's nothing in research that people have actually done to confirm this or disprove it. So really right now, using that term doesn't give us any additional information. It doesn't really help us. It doesn't determine what to teach, how to teach. So it's kind of muddying the waters right now and taking us away from what do we know? What does a lot of research tell us? Is it helpful? Those of us who've been in the field a long time don't feel that label is actually helpful. And it doesn't really tell us what to do. So be skeptical. There's a lot of marketing tactics, a lot of software companies now that market apps to individuals with communication impairments have gotten on this bandwagon. They don't have to be ethical. They don't have to be professional. They're selling products. So just be skeptical. And there's a really good article about it in the Informed SLP. I hope I gave that to Allison, but if not, I will post it in the app, in the chat, so you can have it. But it's the Informed SLP. If you just Google that with GLP, you'll get a really well-balanced sort of look at what is Gestalt language processing. So again, teach what matters most. challenging behavior. And I probably that sometimes clinicians can become married to a system and not open to exploring other forms of AAC, and it may just be because they haven't been trained in that, and they're used to using one. Professionals sometimes can engage in turf wars around AAC, so who has the right to do this? Again, it really depends on your training and your experience and how much experience that you've had in this. Providers who have specialization in AAC may not have specialization in autism and AAC, and vice versa. People may have experience in autism treatment, but not in AAC. So unfortunately, it's up to you as parents and professionals to ask a lot of questions. There are lots of claims in the field of augmentative and alternative communication without supporting research. Remember I said in the last two sessions, overwhelmingly, individuals with autism have been left out of the research in AAC. So there aren't lots of studies using autistic individuals to gather the information that would help us. And so it leaves us with few solid answers about autistic people and AAC use. There's also disagreements about how to best program, how to teach, what to teach, layouts, vocabulary. So unfortunately, in this area, it's really going to be to make some good decision. And that's what I'm hoping I'm helping you do all the way along, giving you those basics and trying to steer you in a direction to, kind of weed out the noise and just let's look at your child or the individual you're working with and let's make some good decisions based on what you're seeing. So we have come to the end of today. Again, I've got the resources that I've had all along that, where can I get these supports and funding, and that we have a couple more sessions coming up still. And let me see, if you can stay, would love you to stay and I'll answer a couple questions. If you can't stay, totally understand that. Please answer the survey or poll. It does actually, we read those, and really comprehensive document that answers all those questions that I will push out to everyone who's attending. If I didn't have time on these very, very, very short webinars, so definitely answer the poll. But I'll look quickly at some of the questions, because these questions, I am so thankful for everyone who's raising some questions. These questions have been so valuable, so interesting to read and so important, because if you're thinking these things, then other people are going through this too. So I've got one right now. Can two different AAC systems be used at home and with a private SLP and a school a different one by a child who's beginning to learn using AAC? Should we insist on using one system? So excellent question. This is what happens. This has been my experience more times than I cared to admit. That is not good service. That is not the best for that child. That is like learning multiple languages. Some of these systems are really particular in how they present things, how you do things, where you find things. And so really what you're wanting to do is get a single system that everyone uses. Then you're going to have the most practice and more intensity with one system. And so what you would do in this case is try and get together as a team, agree on the points that, you want a speech generating system, great. Which the most sense for the child across all the environments. And then you want to look at the literature. And I said it before, there's only a couple AAC systems that have research support at that time. CASLPO to go being one of the top ones. And there's only one or two other ones. Lingo is getting some research, but some of the other ones have had no actual peer-reviewed research. So you're really wanting, I would suggest that you get together. I think the core language article has been put, yeah, there it is. Allison has that, has entered that. Consider, this is a good question, and I'll take this as the last one, and then because we've gone over today. Considerations for when to change from one PC device to another. In my kids' case, we were looking at switching from Proloquo to Go to Proloquo for text. So there's a number of, again, and it's hard because I don't have all the information, but there's a number of things you want to look at. And one of the ways to make a really good decision is to have both available. So you teach both till your child is competent with both. And so really, again, it's about being accurate, effective, and efficient. So you teach both, you present both, and then you should be able to make a determination about their accent. So what their preference, what do they want? Is one better than another? Do you see them using one better than another, or more often than another, or at a higher level than another? Often a full system can do the same as switching. So in PECS, it's pretty clear. We say get to PECS phase 3B, which means I know that the child understands pictures and they're accurate, and then you can switch to a speech generating device. So that's a nice switch after phase 3B, but switching between different AAC apps is a bit more of a difficult decision. So you're going to really have to gather some more information. Again, think about, this is something that your child has spent time learning, may be very proficient on. Is it worth switching them? Sometimes there's a real regression when you switch. And so that's what I'm saying. If you can teach both at once, then make the decision. Often that's a better way to do it. So again, there's some really great questions. Promise, Allison and I read them all. I will answer them in a written format at some point, so everybody has that information. I will not be divulging personal information, but just generally answering them so that more people can benefit from the responses. But I hope you found today's session helpful and you've completed the poll. And again, thank you so much for tuning in. Hope you tune in again to part 4 and part 5. And have a great day. Thank you, everyone.